Namaskar. Today we'll study chloramphenicol. Chloramphenicol is an antibiotic which is a broad spectrum antibiotic, and basically it is bacteriostatic, but against Salmonella typhi and Haemophilus influenzae it is bactericidal. So it is used against influenza, meningitis, bacterial conjunctivitis, typhoid fever, where it is the drug of second choice because nowadays we have better drugs available, urinary tract infection, plague. So these are some of the diseases where we can use chloramphenicol. Against bacterial conjunctivitis we can use chloramphenicol topically. So now let us discuss the mechanism of action. Chloramphenicol inhibits the protein synthesis in bacteria. As we know, bacteria ribosomal complex is 70S ribosomal complex, which consists of 30S and 50S subunits. 30S is the smaller subunit, 50S is the larger subunit. Messenger RNA binds with the 30S subunit, transfer RNA binds with the 50S subunit, and the messenger RNA has the genetic code, and that code represents the amino acids, and based on those codes we have the sequence of amino acids, and hence we have the protein. So which protein is to be synthesized, that message is available with messenger RNA. So 50 to 50S subunit transfer RNA binds. Transfer RNA at one end it has the amino acid, and at the other end it has the anticodon, which is specific towards the codon in messenger RNA. So when the mRNA runs, the transfer RNA recognizes the codon and accordingly supplies the amino acid, and when the amino acids join one after another we have the protein. So chloramphenicol binds to the 50S subunit of ribosome and hence inhibits the protein synthesis. So the translation is inhibited by chloramphenicol. Now pharmacokinetics, chloramphenicol is rapidly and completely absorbed orally, and it can also be given topically as well as parenterally, and it is widely distributed in throughout the tissues and body fluids including cerebrospinal fluid, and it is metabolized by acetyltransferase and glucuronide conjugation, and excretion 10% excreted unchanged in urine, and remainder are inactivated in liver. This is this metabolism done by these two enzymes, glucuronide transferase and acetyltransferase. Then chloramphenicol is an enzyme inhibitor. It inhibits cytochrome P450 group of enzymes. So side effects, chloramphenicol shows bone marrow depression, which leads to pancytopenia, decrease in all blood cell elements, and in neonates they show grey baby syndrome because the body of the neonate becomes ash grey colored, because the glucuronide transferase enzyme is not developed in the neonates. So this metabolism does not occur, and it accumulates, chloramphenicol accumulates and causes grey baby syndrome. Then there can also be hypersensitivity reaction and gastrointestinal disturbances. So major side effect is bone marrow depression and grey baby syndrome. Then let us discuss the drug interactions. Since chloramphenicol is an enzyme inhibitor, so it will inhibit the metabolism of simultaneously used drug which is metabolized by cytochrome P450 group of enzymes. So drugs like warfarin, phenytoin, tolbutamide, their metabolism will be inhibited, so their half-life increases and their serum concentration increases. Chloramphenicol with aminoglycoside antibiotics. Aminoglycoside antibiotics need a polyamine carrier, and that polyamine carrier is inhibited by chloramphenicol. So, chloramphenicol antagonizes the bactericidal action of aminoglycosides. So, this is all about the chloramphenicol. Thank you.